Today is the 10th day of December 2013, and in just over 24 hours, the country will relive that historic moment when the colonial yoke was broken and a new nation born.
Indeed, President Uhuru Kenyatta is due to lead the country in marking one of the most significant milestones in the country's short history.
But tonight, the country is hardly in a celebratory mood following the start of a doctor's strike that has paralyzed health institutions across the country.
Now, we are following that story for you in all its dimensions, and shortly we shall be speaking to our experienced journalists across the country, including Ferdinand Omondi in Mombasa and Mercy Kandie in Eldoret.
But also in this bulletin, we shall have a member of the Commission for the Implementation of the Constitution, CIC, Kamodo Ganjo, here in studio, as well as the Doctors Union Secretary General, Sultani Matendechere, and from Eldoret will be live with Governor Jackson Mandago of Uasin Gishu County. But first, the top stories tonight. Sick at 50, doctors strike dampens Jubilee spirits. Who will save the patients? Agony and death. The strike begins to bite.
With honesty, regardless of our station or our circumstance, we must ask, how well have I applied his lessons in my own life?
He sacrificed so much and was willing to give up everything here for freedom and equality.
A hero's send-off. Thousands attend Madiba's memorial in Johannesburg. And a new role for KDF, but are security experts convinced?
Thank you for joining us this evening, and we begin here in Nairobi, where government and doctors read from different scripts as the nationwide strike began in earnest.
Well, the government insists that the doctors have no basis for their strike, while doctors vow to continue the boycotts.
And the doctors are unhappy about the decision to make them answerable to county governments.
We shall be having a look at the different reactions that have been elicited by this story, of course, especially this time that the country is having the Golden Jubilee celebration. But first, let's bring you a feel of what is happening across the Republic. Let's take you to the Rift Valley, where patients were greeted by empty beds this morning as medical personnel stayed away. Relatives were forced to step into doctors' shoes as they sought to save lives. KTN senior reporter in the North Rift, Mercy Kandie, has a reality check for us. Mercy?
Yes, indeed, Ben Kitili. The nationwide medical practitioners strike kicked off with the effects being felt here in the North Rift region. We visited most of the public hospitals that were all closed, and residents, especially here in Uasin Gishu County, sought refuge in the second largest referral hospital, that is the Moi Teaching and Referral Hospital here in Eldoret town. But the neighboring county, however, in Elgeyo Marakwet County, it was a different state. They have no referral hospital there, just upgraded county hospitals, and the situation there was very sad. Some patients, in fact, a child died early morning today. We visited that hospital, and this is a report that we filed for you earlier on. Take a look.
An artist works on the newly acquired name of the 10-county district hospital that was recently upgraded to a county referral hospital. But this is the only work going on here. Inside, patients moving out. It is midday and the nationwide medical practitioners strike is getting real by the hour. Jacqueline Rotich is among those who decided to act, not to wait, as it isn't clear when the health workers will resume their duties. Jacqueline's 8-year-old son, Kip Kosgei, suffers from meningitis and had been admitted for 3 days.
Ameendelea vizuri lakini hajamaliza dose.
Fearing Fearing for the health of her son, Jacqueline decides to look for a chemist where Kipkosgei would get today's injection. She is, however, not able to get the injection in this chemist as she does not have the child's medical file or prescription. In another word, desperation. None of these patients, who are mostly the elderly, have been given any attention.
Hakuna kitu tulisema tukaambia muondoke, hakuna mwenye atahudumia leo, tukatoka. Sasa wagonjwa angalia ni vile wako.
Medicine that had been administered the night before the strike is what many here hold on to.
Tumefunga hiyo sasa kwa na relative. Sio ati nurse, ni relative tu ndio ameona. Ni vile tu saa nyingine hao siku ile wakikuwa wanamwambia kama maji ilitaka kuisha unaweza kurudisha chini. Lakini sasa wametumia hiyo mbinu tu peke yake kufunga.
Caroline Nyekwel gave birth to twins today at 4 in the morning. She says she is lucky to have a nurse assist her in the delivery, but not too lucky. The other baby died minutes later. The child's body lay in the other room. No one to take it to the morgue. Her surviving child had not been cleaned since the delivery. Jacqueline tells me she's not able to breastfeed. She is still under blood transfusion and can't remove the needle to hold her baby. All public hospitals remain closed as many patients sought refuge at the Moi Teaching and Referral Hospital, which is still under the national government. The medical practitioners downed their tools Tuesday in objection of the devolved healthcare system. The effect of it, only patients know. Inside this ward are patients in very poor health and relatives who are trying to act in the capacity of medical practitioners, trying to help wherever they can. Those who have remained inside this ward are not able to be moved either because of their health condition or financial status. Marcy Kandia, KTN, in a 10-county hospital in the county of Elgeyo Marakwet.
Well, the situation was not that different along the coast, and right now we're going to speak to Ferdinand Omondi, who has been following those developments from Mombasa. Good evening to you, Ferdinand.
Good evening, Nancy. The situation here in Mombasa is no different. The doctors describing their strike as successful, and you know exactly what that means for the patients. Already we're getting information that 2 may have died already, and that is not really a surprise if what we saw in the morning is anything to go by. Take a look. At the emergency and casualty wing of the Coast General Hospital, a man lay sprawled on the floor, sometimes motionless, sometimes writhing. He was soaked in blood, evidently badly wounded and in dire need of help. It wasn't clear what time he arrived. What was clear was that it wasn't the day to seek help from a public hospital, as none was forthcoming.
Sasa kuna vile madaktari hawashughuliki, hakuna mtu anashughulika. Sasa tuambiwa tungoje penti ya damu atawekewa, lakini mpaka siku ile watakuwa wako on.
At the hospital's maternity wing, one Amira tells us how her sister, who was 6 months pregnant, delivered prematurely with not a single medic present to help.
Tukamchukua vizuri paka kwa daktari, kwa pale mlangoni kwa askari, tukamweleza askari tufungulie tuingie nao mtoto, wakakataa.
It was up to other women who had come to seek medical attention who aided in the delivery, cut the placenta before transferring the pair to a private hospital. The hospital waiting areas and benches were a sorry sight of people waiting for medical attention in vain. Even some who were admitted in wards were sent back home, save for those freshly out of operation or recovering from fractures.
Na nimevujika viungo safari 4. Sasa naambiwa ningoje mpaka mgomo ije ndivyo nitibiwe.
Nimefanywa operation sasa na kidonda kina karibu siku 2. Leo ni ya 3 bado haijaoshwa, na sasa sijui nitaoshwa lini.
Medical practitioners in public hospitals have downed their tools in protest of devolution of medical services, citing a raft of unsolved issues which they feel will undermine the profession.
We stand to lose the certainty of our jobs. Number 2, we stand to gain domination and interference by political operatives, and it's already happening. Okay, an MCA walks into a casualty and demands that his is an emergency, and that yours is not, as if you're not the professional.
The strike comes at a time when the country is about to mark 50 years of independence, and it appears the medical sector has little to smile about. Ferdinand Mundi, KTN, Mombasa.
This is a story that has elicited a lot of mixed reactions from Kenyans across the Republic, especially this time that the country is celebrating the Golden Jubilee. Now let's bring in some reactions. Of course, we shall be talking to a commissioner of the Commission of the Implementation of the Constitution, CIC, that is Kamotho Waiganjo, who is in the Central Business District in Nairobi. We also have with us Sultani Matendechere, the Secretary General of the Kenya Medical Practitioners and Dentist Union, who is also with us from our city center studios. We also have a governor, that is the governor of Uasin Gishu County, Jackson Mandago, who is coming to you live from the county of Uasin Gishu. Now, gentlemen, this is a story that has brought it is an impasse currently. We have seen the situation in the different hospitals across the country, and the doctors say they will not budge. So what is the way forward as we speak? If we can start with you, Dr. Sultani Matendechere, your workers, your colleagues say they will not budge as far as the strike is concerned. What do you think is the way forward as we speak?
Okay, I think, first of all, let me say that it's a very big shame for us to get to this kind of, this point, just because we cannot be able to engage, we cannot drop our positions so that we can be able to come to an understanding. And this is a very poor show of leadership on our part, especially on the part of the government, because we have been engaging the government, and the government has been very adamant. They do not want to listen to the concerns of the health workers. But we are saying that as leaders of the health workers, we are ready anytime to sit down and agree with the government on a formula that is going to allow us to immediately end this suffering. Because we know that healthcare is an essential service, but we have come to learn of the shocking fact that in this country, the authorities do not want to consider this essential service as such.
Okay, Dr. Your colleagues are saying that their main grievances are the salaries, emoluments, and of course the career development functions, which you are saying they should not be reversed back to the national government. Let's bring in the CIC Commissioner, Kamotho Waiganjo. What does the Constitution say about this? Because it's a bit of bringing a bit of confusion.
Yeah. One, I think let me say that it's unfortunate that we are talking about this 2 years after the devolution train left the station. The reality is that Kenyans 2 years ago agreed that we were going to devolve all services, especially those services that affect Mwananchi, where it really matters. And one of those was health. All the laws that were necessary to ensure that this was done sequentially were passed. The County Government Act, the Transition to Devolved Government Act. The doctors have been part of this nation and part of the conversation about an effective way of transitioning to ensure that services are delivered where the Constitution requires them to be. I think for us at this point to be talking about the possibility of recentralizing, because that is what this conversation about, the possibility of recentralizing is unfortunate. Remember that when it comes to the question of salaries for doctors, they are protected by the law. The county government law that exists protects the salaries of doctors. It protects their pensions. As long as you are employed before 2010, those salaries are protected. What we must recognize as a people is that devolution is now a reality. That everybody must now recognize that the county governments are legal entities that are entitled, are allowed to provide services. They have the funds to pay for those services. The question of standardization of salaries in terms of services is already agreed upon. So I think what is happening now is a desire to have a centralized process of managing staff. And I think we need to remember that for 50 years, we have tried centralized provision of services. If you ask the Kenyan in Wajir, health services have not been delivered properly. Why don't we allow the constitutional framework that we chose in 2010 to work? If it doesn't work in 3 years, we are the same people will come back reevaluate it.
What the commissioner is saying is the what the commissioner is saying is the main bone of contention, Dr. Matende Chere.
Yes.
The commissioner is saying that your salaries will be taken care of because it is inked in the constitution. Are you satisfied, Dr.?
Okay, I think that is also one of the areas where we are not communicating with the government, because we have expressed that we are worried that this function that is held was devolved without any legislation being put in place. So right now we are devolving that function, and yet we don't have a guideline. We don't have a legal framework. We don't have a health policy in place. And that is why we are seeing a lot of confusion coming up. Recently, we even saw some documents coming around from the counties which are proposing salary cuts. We have seen people going to supervise doctors who are working in the hospitals, and yet these are just political officials within the county, because we don't have any set legal framework which is saying that this is how the HR policy is going to be rolled out. Who is going to supervise? How are you going to be paid? So now we are seeing a situation where advantage is being taken, or the absence of laws and policies, so that we can harass medical personnel. Now this situation is degenerating by the day, and we have been engaging the government since March.
Thank you, Dr. Now,
you
and your colleagues, what you're saying is that you do not want what you're calling being forced to be absorbed by the county governments. And of course, you're saying some of your colleagues have said that being absorbed by the counties will cause other things like nepotism and tribalism. And of course, you're worried about your salaries. Let's now bring in the county governor of Uasin Gishu, Jackson Mandago, who, sir, you are supporting this initiative. You seem to think that this can work. Tell us.
Thank you, Kitile. One, basically, nothing has changed. What we are saying, a doctor that was working in Moiben Sub-District Hospital is still working in Moiben Sub-District Hospital. The salary that doctor was earning is still earning that salary. Number two, the scheme of service for nurses, for clinical officers, for doctors remains the same scheme of service that has been there. So there is no reason, absolutely, as to why the medical practitioners should worry about that. In fact, they should be happy, because what county governments have done is to put in a lot of resources, improving physical infrastructure and equipment, and ensuring the steady supply of medicine, which was not there before. If I give you a case example in my county, Moiben Hospital never had electricity.
Governor, are you going to slash the salaries of doctors?
That is, let me not be a little bit rude, but let me say, let them not stretch their minds beyond the normal. We are responsible citizens. As governors, we made the decision before the national government did, and we said counties may not have capacity now to handle the payroll. That's why we decided, as a council of governors, that the payroll be handled by the Ministry of Health for at least 6 months. Now, that has given us opportunity to go through the number of health staff we have. After doing our own audit, we discovered so many counties are paying so many health workers who are not in the station. What the health workers are not telling us is what they fear most is the close supervision they are going to receive from county governments, and that is their worry. You've had the governor of Elgeyo Marakwet being treated by a watchman. What kind of practice is this? When I look at their memorandum, they are saying there will be no standards. What standards have they been following? Because
Thank
they
you,
have been
Governor.
serving in those hospitals, there must have been standards.
Thank you, Governor. Commissioner Weganjo, just very quickly,
Yes.
what is the way forward? What are we supposed to do as a country to avert or to make sure we solve this problem?
Now, I think part of the problem is that we're sometimes we are not a very dishonest country. I think part of the problem is we do not identify our real problems. The reality is that doctors' salaries, doctors' terms are protected. All the legal systems that are necessary are in place. Whatever is remaining, the Public Service Commission is supposed to be doing. I think if we recognize that devolution is a reality, let us find a way to ensure that people's terms are protected the way that the law has protected them. But if we take the position that the only way we will work is we work like the teachers work under TSC, under KNUT, we will bring our country down, and the people who pay a big price are the people who get our services. And it's unfortunate when it is professionals who are leading this cause. I think it is very, very unfortunate. Let's reason together and agree that we agree to devolve. We agree to devolve as a country. Everyone must recognize devolution is a reality.
Thank you, Commissioner. Thank you, gentlemen. It was a pleasure talking to you. I've been talking to the Commissioner of the Commission in the implementation of the Constitution, CIC, Kamodo Waiganja, and of course, the Governor of Uasin Gishu County, Jackson Mandago, as well as the Secretary General of the Kenya Medical Practitioners, Pharmacists and Dentist Union, Dr. Sultani Matendachiri. Thank you, gentlemen. Always a pleasure talking to you. Let's now take you to our top story, and of course, the government and doctors read from different scripts as the nationwide strike began in earnest. The government insists that the doctors have no basis for their strike, while doctors vow to continue the boycott. The doctors are unhappy about the decision to make them answerable to county governments. KTN's Sharon Momanyi begins our coverage on that, continues our coverage on that particular point with a tough talk in the capital as patients suffered across the country.
Across the country, patients arrived to a sickening sight. No nurse to welcome them and no doctor to relieve their pain as the strike called by the health practitioners kicked off. But in Nairobi, no one was yielding any ground. Cabinet Secretary for Devolution Anne Waigoro says the matter is now off the hands of the national government and into those of county governments and the Ministry of Health.
Kitu ambacho kimewafanya waende strike ni kitu ambacho haziwezi kufanywa na serikali kwa sababu it's a legislative issue that has to do with the constitution, and we cannot promise that we will do it because according to the constitution it does not allow.
But the Workers' Umbrella Union claims devolution of these functions will promote nepotism and tribalism and thus may cripple the very critical function of the health sector. It seems though that this will not come easy.
There must be a guiding principle as what is provided for in Constitution of Social Security and the new bill.
They are not labor issues. They are issues that are beyond the resolution of either this, the Council of Governors or the national government or even Parliament. It will require, some of them would even require a referenda.
The immediate concern at the moment is the lives of the scores of Kenyans who depend on public health services.
Hii mishahara inatoka serikali ya kitaifa. Hakuna pesa ambao inatengenezwa na serikali za county. Governor anafanya kazi kwenye county, mishahara yake inalipwa na serikali ya kitaifa. Properly secured by the national government. Senator anafanya kazi yake kuwakilisha county. Mishahara yake is properly secured by the central government.
Speaking to KTN on phone, Cabinet Secretary for Health James Macharia says that the situation is dire and calls for drastic measures.
Start to the counties, you start recruiting. Some of them have started recruiting. Today's paper you saw, I think it was Bomet County. They advertised for jobs including health workers. For us as a ministry, we have so many people who had applied for jobs. They were put on reserve. So we shall welcome them. We shall actually employ those people to go and fill the vacant positions. And so we are putting measures in place to, unfortunately, we have to do this.
But on their part, the Kenya Union of Civil Servants has opposed the strike. They say that over 80% of health workers belong to the union, but they found no basis for this decision.
It's true we participated in the passing the Constitution of Kenya, and we realized there are a lot of gaps. Those gaps cannot be addressed through the strike. We can only correct them if we follow the right channel.
The bone of contention is the salaries and emoluments, as well as the career development functions of the health sector, which the union wants to be handled by the central government. At the moment, hospitals in Eldoret, Nakuru, Laikipia, Kisumu, Kakamega, Migori, Bomet are among those affected. Sharon Momanyi, KTN.
The Big Q in association with Kenya Power.
Well, the previous story leads us to our big Q tonight. We're asking you, should the striking health practitioners be fired?
Tell us what you think. SMS your yes or no response, plus a brief comment, of course, to the number 22155. You can also tweet us at Ben_Kitili, at KTN Kenya, and at Kachungira.